This patient lower anterior we are planning for rehabilitation, canine to canine. Both these canines are mobile. The anterior tooth automatically fell off. We will see the cross section. This is the left canine, highly supraerupted and mobile also. The anterior mandible 3141 area. It is looking good. The canine, the thing is, anatomically the root is close to the premolars. So while placing implant, we should not place along the canine. Better to place it mesially angulated to avoid damaging the premolar. We will see the cross section of post-op implants. So this is the reformatted view. You can see the abutment is not near the canine, almost in the midline. We have placed 3 implants. The implant is enough. This is the panoramic view. We can see we have avoided the extraction socket of canine. This is a compressive implant, 3.75 into 13. We have got good stability, so no need to select very long implants. The entire lower anterior bone is, lower anterior mandible is cortical. This is 3.75 into 11.5. The bone is very dense, so we have selected a shorter one. And this implant is after extracting the 3.3. So this is 3.75 into 16.